The topics and opinions expressed on the following show are solely those of the hosts and their guests and not those of W4WN Radio, its employees, or affiliates. We make no recommendations or endorsements for radio show programs, services, or products mentioned on air or on our web. No liability, explicit or implied, shall be extended to W4WN Radio, its employees, or affiliates. Any questions or comments should be directed to those show hosts. Thank you for choosing W4WN Radio.
Welcome to Fearless, Fabulous You. I am your host, Melanie Young. Thank you for joining me today. If you're joining me for the first time, I love helping women make smart, confident choices about how they choose to live, preferably life on their terms, to stay fit, healthy, and always mindful of enjoying life to the fullest. I am going to be addressing a topic today that actually hits home in a very, very personal way. We're going to talk about new therapies to treat painful joints and neuropathies, including arthritis, with a specialist in regenerative medicine, a pain specialist. This hits home for a lot of reasons. First, I'm going to start with some stats. Arthritis, which is a big one, affects over 54 million people in the United States. 60% of U.S. adults with arthritis are working age, 18 to 64. Arthritis can limit the type of work they do, or prevent them from working at all. And it is the leading cause of work disability, with annual costs for medical care and lost earnings of $303.5 billion. That's from the Arthritis Foundation. Why does it hit home for me? My mother, who worked to 85 as a professor in Tennessee, was crippled with both osteo and rheumatoid arthritis to the point that she could no longer feed herself. She was given many, many types of medication with no explanation of side effects and went bald, lost her hair. Toward the end of her life, she ended up falling and never getting up, and was the point where she was unable to feed herself and was malnourished. So we had to arrange very expensive rounds of people to help her until she eventually died, never got out of her bed again. And watching that and being reminded almost daily as I cared for myself that this is genetic, or could be genetic, I was fearful as well about becoming disabled through pain. And likewise, my husband experienced a neurological episode in 2016 that has left him with ongoing neuropathy. So I am interested in this because I deal with my own pain through some degenerative back issues. My husband has neuropathy. So many people have confided to me they're getting, of my age, they're all getting surgeries now to deal with joints. I mean, if I hear another friend who's getting knee surgery, I'm just going to everybody's getting new knees. But there's also non-surgical options. And we're going to talk with a regenerative medicine specialist to address these, because I think many people would love to avoid surgery, avoid expensive medications and side effects, and find ways that they can manage pain without going into extremes. Sometimes you can't avoid it, but let's find out more from Dr. Thomas Buchheit, who is a physician specializing in regenerative and auto-biological treatments for joint and nerve pain. He is the founder of Triangle Regen Medicine and Biologics Center in Chapel Hill, North Carolina. Go Chapel Hill. And he has worked as an adjunct associate professor at Duke University. He has a book called Healing Joints and Nerves, Immune Stimulation, and the New Science of Regenerative Therapies. Dr. Buccheit, welcome to Fearless, Fabulous You.
Well, thank you for having me, Melanie. I'm delighted to be here.
Yeah, I see you're in Montreal. He's giving a speech. He travels a lot. So thank you for your time.
Yes, no, thanks. And I think this is a really exciting time. We have learned so much over the past couple of years, and our ability to treat arthritis, the ability to treat neuropathies that we didn't know, even recently. And I think what it comes down to is that our bodies have the ability to self-repair and to self-heal. Mm-hmm. The goal, and my goal as a clinician, and I think the goal of really the medical specialty, is how do we find ways to turn on those healing mechanisms? And that's what the book is about. The book is about teaching and giving people the tools, giving women the tools. How do they turn on their own healing mechanisms? Some of that is with exercise. Some of that is with regenerative therapies when they're needed. And some of it is also avoiding some of the things that can lead to further problems. And we can talk a little bit more about that as well.
Well, definitely. And I read your book. There's a lot of clinical terms in it, but you have these great giveaways at the end and a glossary. Thank you. I'm all about glossaries. And I went through, and I'm one of these people that likes to get the book sent to me. I actually have the book. I put it in the images. I don't know if Juan has it or not, but I'm holding it up right now, sort of. Yeah, there we go. So I'm going to start with this. Let's talk about causes first, because my mother reminded me every day from her bed. It's genetic. You're going to get it. Like the Wicked Witch. And so what causes neuropathy? And who is more susceptible to it?
Let's start with arthritis, because I think you've mentioned that, and that's an important thing that affects a ton of people.
Yes.
The good news here is that the genetic components to this are low. Most of this are things that we have control over, and I think that's an important message for everyone, or everyone out there. There's also a bunch of mythologies that I deal with in the book, and one of which is the concept of wear and tear, which is just not true. Exercise is good for joints. Matter of fact, one of the most effective ways of keeping joints healthy, even in folks who have mild to moderate arthritis, is walking. It's just as simple as that. Walking and exercise improve the environment of the joint. They improve the capacity of the joint to kind of renew and restore cell health. And so that's really an important thing. The drivers of arthritis is really, it's chronic inflammation and the enzymes that chronic inflammation turns on. So if you have chronic inflammation in a joint, the enzymes can actually start to digest the cartilage parts. And that's what drives osteoarthritis in particular. The challenge that we've been into the past 75 years now, we've been doing steroid injections, for instance, for knee arthritis for 75 years. The first case series was done in 1951, so it's exactly 75 years. And those are really good of shutting down short-term inflammation. We also used to think that those steroid injections helped long-term inflammation. It turns out that they don't. In fact, those repeated steroid injections actually can backfire and cause more problems than they create, especially if we have them in repeated fashion. What happens is that the steroid might decrease short-term inflammation, but it also turns off our natural healing capacities. We have the ability to produce growth factors, to produce healing mechanisms and healing proteins in the joint. And repeated use of anti-inflammatories, repeated use of steroids shut down those natural capacities. And so the book is about how do you regain that? And again, exercise can do it, nutrition and foods. There's certain foods that can be very helpful and can do that as well. And then I do a deeper dive into the regenerative therapies, things like platelet-rich plasma, autologous conditioned serum, stem cells, and the like, and what their actual role is.
Let's talk about the simplest and least expensive way to manage, which is diet and exercise. I want to start with exercise. I am a big believer in motion is the lotion. I wake up every day feeling like the Tin Man. I'm 67 now, and I have a degenerate back. I also had some stomach issues that have caused a stomach surgery that has just been so painful. So if I don't exercise, I literally feel like I'm like the Tin Man in The Wizard of Oz. And so I walk a lot. Too many people these days are sedentary. Let's underscore the importance of how the simple, inexpensive process of walking matters, but also what else can people do in terms of exercise? And also, what are some exercises that may exacerbate the situation as well? So you have to be careful.
Well, you have nailed it on the head. So you've got it exactly right. Exercise, motion is important. Motion lubricates our joints. Walking will actually increase literally the lubrication in our joints. So we have this substances we can call hyaluronic acid. Some people know of it because it's in cosmetics as well as our joints. But this is a lubricant. It's a lubricant for skin. It's a lubricant for our joints. And your body will make more of that with exercise. You increase blood flow and nutrient flow to cartilage with exercise. So a daily walk is about the most effective thing that somebody can do. There are other very effective treatments and therapies, things like yoga and Tai Chi. Tai Chi can be, a very powerful tool for someone who already has very stiff joints. and foods, healthy foods. I wrote the chapter on nutrition and food was, I think, one of the more difficult ones I wrote because I did not want to use the word diet in it. Because diet is a triggering word to a lot of people, and everybody has very strong feelings about that. And so I wanted to talk about were foods that fuel our bodies, and they include healthy fats. So, for instance, fish oils, olive oil, avocado oil, those are healthy fats. They include leafy green vegetables and colorful vegetables. Those colors are protective compounds for the plant. And then when we eat those protective compounds, they help us protect ourselves. And so there are ways of giving our body these fuels. And so that is the starting point for really everyone, which is give your body the healthy fats and the plant color compounds that are protective, and go for a daily walk. And it's a wonderful place to start for anybody who can do that.
So I agree with you about the word diet. I call it editing. So I just rearrange words. So as you know, the U.S. dietary guidelines came out, were moved around a bit. The Mediterranean diet, which is a big focus on whole grains, kind of went down to the bottom, and animal fats and dairy went to the top. And anyways, I thought it was great. I do believe in whole grains. I'm a big believer in the Mediterranean diet. However, a lot of people still, I think, left a lot of people confused about what fats are okay. Because when they hear animal fat, it doesn't mean you can go out and eat lots of burgers. You go into the book, you do dive into fatty acids and fat quite a bit. So could you provide a little more explanation about what you consider? I mean, you touched on it with monounsaturated olive oil, and you mentioned avocado oil. But what are some other examples of fats that you think are better for you versus maybe hold off?
Well, yes, and I try to think of it. So I try to think of them as fats that are straight fats, so that line up and can stiffen things like membranes and cell membranes. Fats that have a kink in them. So, for instance, olive oil has a kink in it, and it's a fat structure, and ones that are curly. So omega-3s that are seen in fish oil and flaxseed oil, those are curly, and they do different things based on their shape. But the other thing that we have to keep in mind is that if someone cooks, and I am a big believer in the Mediterranean diet as well, but if someone cooks with olive oil, yes, they're getting the healthy fat, but they're also getting all the wonderful plant compounds that come in the olive as well. So it's a twofer. They're getting the healthy compounds in the olive fruit, and they're also getting the oil that can be healthy.
What are your thoughts on canola oil?
Oh,
Seed oil.
that's a subject I wouldn't mind avoiding talking about right now.
I know. There's a lot of pros and cons, and I have
Yes,
dietitians that love it and dietitians that don't, but there's a cooking issue to it too, because it's very hard to cook sometimes with olive oil. Like, we use it all the time, but you know.
Yes, and I would preface this by saying I am not a dietitian.
Neither am I. I'm a health coach. So
what I tried to do in the book was look at things that are healthy for joints and nerves.
Right.
And there's enough literature and there are enough studies to say that a Mediterranean diet and the components of that are healthy for our joints.
Yes.
They decrease chronic inflammation, and they're healthy for our nerves. And that's kind of where I start, and that's where I stop, is what do we know?
Absolutely. And of course, if you travel the Mediterranean, which I am blessed to do often in my wine and food life, they move around a lot. People in Europe take walks. They walk
Absolutely.
they walk in the morning, they walk after a meal. They don't lie around, sitting around, staring at their computers and phones all day. And kudos to them, that long life. Go to Sardinia, one of the blue zones, and you'll see some of the healthiest people ever. It's incredible. I am going to ask you about one food area, and then we can move on to some other thing. Sugar. And the reason I'm going to ask you about sugar is I have issues with it for a variety of reasons, emotional as well as physical. I actually get physically ill now from eating sugar. And my mother was a sugar addict, as I have prefaced. She had probably one of the most severe cases of arthritis imaginable. It was tragic. And she was a sugar addict also. Is there a connection?
Well, yes, I think the short answer is yes. And unrefined sugars do things metabolically to our bodies that are not healthy for us. They spike our sugar. They cause insulin resistance. They cause diabetes, and any metabolic derangement from excessive simple sugars can be harmful to us. Now, I am also guilty. I do enjoy a chocolate chip cookie, and so I can't be critical of all refined sugars, but I think it's like everything. We should consider it as diet in moderation and sugar in moderation. But anything that is chock full of raw sugars that absorb quickly, that spike our glucose, and that cause these surges of insulin to compensate for it, may not be good for us, and certainly aren't good for our joints either.
Are there other, and then dietary food choices that should be considered or not considered, other than what we just talked about, which is vegetables, fruits, whole grains, and healthy fats?
What I talk about in the book is a very broad scope, and I look at it, and I think the more food colors that one can consume, the more plant colors that one can consume, is a wonderful thing. And I take the blueberry or the grape, for instance. Even these compounds called flavonoids or polyphenols that are in grapes, they're in blueberries. We have tried as a culture and a science to try to isolate a specific compound. Resveratrol was one of those compounds where everybody was very excited about it. But it turns out that it's not just resveratrol, it's probably the 300 other compounds that come in the blueberry, in the strawberry, in the grape, in those colorful berries and fruits and vegetables that are also part of this picture. And so for me, it's not about isolating one specific food or one specific molecule. It's really about that beautiful complexity of diet that we can get that you get when you travel, for instance, and then we all get, if with a Mediterranean diet. But I think a rich collection of fruits, vegetables, fish, olive oils, I do think it's the heart of healthy joints and nerves.
I couldn't agree more. I have to smile and laugh, though. I'm in Italy a lot for my wine life. And the Mediterranean diet for me looks white because whenever I live in Tuscany, depending on the time of the year, there are fewer vegetables. It seems like all I'm ever served now is white pasta and rice because I don't eat meat. In moderation, basically everything in moderation, even sugar. I mean, it's Mardi Gras here in New Orleans. You have to have a king cake. You have to have some king cake. It's just what you do. So you gotta, not give up, but don't go overboard. One last thing on exercise, and then I want to move on to some other topics. A lot of people my age or even younger now, I feel like I'm the older part of the older part. They're doing pickleball, and there's been a lot of injuries, including my husband, on pickleball. And yet everybody seems to be doing it. Explain why this is a risky sport. What are some other sports because people want to do other things besides walking. I have a friend who's constantly saying, I have to keep moving or I'm going to die, so she wants to find sports that are better for her joints.
Well, I think weight training is also an important thing to consider. So I consider pickleball as a high velocity sport. There's a lot of starting and stopping very suddenly. That puts tremendous strain on tendons and ligaments. And I've taken care of several people who have had hamstring tears and other kinds of knee and hip issues and shoulder issues with pickleball. We need to consider the fact that training is necessary for pickleball, just like any high velocity sport. And I'm a big believer in, not just aerobic exercise, but some strength and flexibility training as well. So I think part of the pickleball routine might also be a little bit of time in the weight room to put muscles under strain. One of the core things I talk about in the book is that we need these cycles of inflammation and recovery to be healthy.
Right.
And any of us who exercise, whether it's walk, whether it's aquatherapy, whether it's pickleball, we kind of know that at our core. If you go out and you play 2 hours of pickleball and you haven't played all season, you might not be able to move the next day, right? So you have to build up. And exercise is this wonderful technique of short-term inflammation, kind of Goldilocks zone inflammation and recovery, inflammation recovery over and over again. And those cycles make us stronger. And that's the core. That's the core of exercise. That's the core of how we make ourselves stronger. That's the core of how we protect ourselves from injury with a pickleball game, is to go ahead and train ourselves prior to. And interestingly, that's also the core of all these things that we call regenerative therapies. They use the same mechanisms. They stimulate the immune system like inflammation does, like exercise does, and then it releases these growth factors that can strengthen tendons and ligaments, that can repair tissues. But we do that with exercise as well. And so I love hearing how avid an exerciser you are and how much you believe in it, because I think it's a really important part of long-term health.
I'm a big believer. I do believe that one of the problems is people don't stretch. There's not adequate stretching before you got to prepare your body before you exercise. Two, you don't just take up weights. You've got to go and pay and hire someone to teach you how to do it
Yes,
properly. Um,
absolutely.
and it's like that with any sport. You actually write about in the book how you went to, you had a whole mess with your knees skiing because you were with some young people. And, like I tell my husband, David, all the time, he wants to go skiing. He wants to go skiing. Okay. He had an episode, I referred to it, where he has neuropathy in his left side still, because he didn't do the physical therapy he should have. And he wants to get back on a snowboard. And I said, let me check my life insurance policy and make sure it's up to date, because when you go on that snowboard, there's a good chance your body is not going to be the same as 20 years ago. And I think a lot of people, when they reach 50s and 60s, they keep trying to do the same sports and activities that they were doing in their 20s and 30s, and they've got to do it differently, right? I mean, you had a
It
chair,
it just takes
skiing.
it just takes more time.
Yeah.
When we're all I'm 57, I'll be 58, and so it takes me longer to train than it did when I was 20.
Yeah.
And then I think that's just part of life. But the good news is we can still get there.
Yeah. You
We can still
can.
get there. It just takes a little more time and a little more dedication, and perhaps the ramp up is a little slower,
Yeah.
but you can still get there. You just have to give yourself time. And
I
I
mean,
think
yeah.
that's back to your pickleball reference, which is a really wonderful, great one to use, because you can get there to where you can handle those high velocity motions well, but you got to train yourself beforehand and strengthen, because tendons and ligaments, again, they need those cycles of strain, rest to be strong enough to handle the sudden stop on a court.
So, how do you define it? So I regenerative is a buzzword in many industries now. Regenerative farming and wine, regenerative. What does regenerative medicine mean? And give some examples.
I like to think of regenerative medicine as ways to restore tissue health and joint health and nerve health. There are different definitions. Some people talk about growing organs and growing new body parts, but the way that we use them to, for instance, to treat osteoarthritis or nerve issues, it really is restoring health of those tissues, and that's how I see it. I've used the perfect example of platelet-rich plasma, which is a commonly used therapy that people use for joints. They use it for hair replacement. It's also called PRP. It can restore and improve tissue health. It doesn't grow new cartilage. Actually, none of these therapies will grow new cartilage where there is not cartilage now, but they will take whatever somebody has and can improve it. And it's the same thing that our body does. So it's a stimulus. With PRP, it's an inflammatory stimulus. And then that releases growth factors, and your body takes those growth factors and it improves the tissues and improves the strength of the cartilage, the tendons, the ligaments. And so it's the same process that we use with a workout.
So I have a question for you. Why is it that when you go to the doctor, any doctor, and you have pain, the first thing they want to offer you is a steroid injection or medication, ranging from how do you say NSAIDs to I've got a slew of them in my place. I hate all pain medication. Why is that? That's the first thing you're given versus other alternative options?
I think there's two reasons. One is history. We've been doing it for a very long time. We, the medical profession, have been doing this for a very long time. And I have done a lot of steroid injections. I've done 25 years of steroid injections, well, probably 20, 25. The past 10, I've really tried to focus on things that improve tissue health. So one of it is history and tradition, and one of it is it's a quick fix. So we know if we inject a steroid into somebody's shoulder or knee or back, that they're probably going to feel a whole lot better in 2 or 3 days right afterwards. It's a very quick fix. We also know that there are downstream issues with that. And there was a paper that came out in 2017 that for me was a wake-up call. I think for a lot of us was a wake-up call. And it was a study that looked at individuals who had knee arthritis. Half of them got steroid injections for 2 years, half of them got saline injections for 2 years. At the end of 2 years, there was no difference in pain. Not a big surprise to anybody, right? Because we know that steroids tend to work short term and may not last. The problem was those who got steroid injections actually had less cartilage in their knees than the ones that got saline. So to me, that was a wake-up call. We had all thought, and I had thought prior to that, yeah, we're doing steroid injections and they help, and they probably don't do any long-term harm. Maybe they help a little bit long-term harm. I had no idea, and a lot of us had no idea that we were probably actually worsening the problem of arthritis in patients. And that's why I think we are in such an important paradigm-shifting moment. This is a particular issue for women who are more affected by osteoarthritis than men, who get more steroid injections than men. This is an important issue that I think all for your listeners and your viewers, that a steroid injection once I think is just fine, but they really need to be careful about repeated injections because it can actually harm the very joint we're trying to treat and trying to treat.
Well, aren't some of these protocols you can't, once you stop, everything reverts back, like or do you, because I always worry about that. Like, do you ever get off of those drugs?
Right, and so it does revert back, and the effects are short term.
Yeah.
In terms of the pain relief, but I'm more concerned about how do you keep the cartilage, the tendons, the ligaments, and the nerves healthy long term.
Right.
And steroid injections are not doing that. Steroid injections are giving us a short-term fix.
Right.
Now, if that short-term fix gets somebody back into the gym and gets somebody back to their exercise routine, well, that's good long-term, right? Because they're exercising. They're exercising again, right?
Yeah.
But if it's used just in a repeated fashion, if somebody's giving 4 steroid injections a year into the same joint, we know now that that's gonna do harmful things to the joint longer term.
So what are the ways to repair cartilage and tissue?
Well, that's when I look at, so you've mentioned the first two important ones, which are healthy foods and exercise. A lot of people, that is not enough. Take an example, somebody who's had a prior injury, an ACL tear, which we've heard a lot about that, and Lindsey Vaughn has been front and center with dealing with. She is an amazing woman, first of all, but dealing with those kinds of issues of ACL tears or meniscus tears that set people up for arthritis. But sometimes exercise and healthy foods may not be enough, and that's where things like platelet-rich plasma, a therapy called autologous conditioned serum, which is also called Regenekine, which I do and started in Germany, and even stem cells, which don't actually grow new cartilage. Stem cells also work by turning on our own healing systems. All these therapies can help push us to the next level and help kind of turn the page on healing a joint that won't heal.
Why are all my friends getting knee surgery? Or shoulder surgery or elbow surgery? Every week somebody's going in for surgery.
Right. So knee replacement surgery for someone who has significant pain and bone arthritis, I think can be it's an effective procedure for 80% of those who have it. And I think my goal is to allow people to hopefully avoid that knee replacement surgery. And I truly believe that if we can get to people early enough, for instance, someone who's had a meniscus tear, someone who had an ACL tear, they still have cartilage in there. The cartilage may not be healthy, but it's still there. If we can get that cartilage healthier, they may never need a knee replacement surgery. And that, to me, is the exciting part of where we are now, is what we now know how to improve the health of those joints. If we can get to it early enough, before it's bone arthritis, they may not need surgery.
Well, the first thing is, if you have pain, don't just shove it away and go there and pop your pills. Go see somebody. That's number one. And number two, get on the diet, get on the healthy eating. and exercise, movement, if you don't like the word exercise, track and do that. And those are simple things to do immediately, and don't wait, because the longer you wait, the worse it gets.
I think that's very good advice. If somebody has persistent pain, like many of us did, like I did after a couple of knee injuries, if you have persistent pain after a knee injury, that's a sign that for lack of a better term, the biochemistry of that joint is off. And we need to find ways to improve the health of that joint fluid to improve the health of the joint. But you don't want to wait until it's eroded the cartilage and you're bone-on-bone arthritis, and you end up looking at joint replacement surgery at that point.
Well, I was reading the book, again, my mother was given lots of drugs. I was devastated, actually, when I saw, I hate mentioning drugs, but I'm going to, gabapentin.
Yes.
Can lead to cognitive decline.
Gabapentin is a double-edged sword.
She was on
right?
gabapentin for years.
Sure, and it can decrease nerve pain, but what I talk about in the book also is, well, gabapentin was developed as a seizure drug because it prevents nerves from firing in the brain. So we know it's going to dull brain function because it was designed to dull brain function. Now, it also happens to dull nerve, it's called automaticity, so nerves that are firing out of control in our peripheral nerve system. And that's why it can help out with neuropathy pain. But the side effects, to me, are almost expected because it was designed to affect our brains, and when it was first put together.
Well, I always tell people, because the other one she was given methotrexate, her hair fell out. That's for chemotherapy. So, unfortunately, a lot of people, including the elderly people like my mother, people don't ask questions. They just take what the doctor tells them, and they take it. Maybe they take it incorrectly, but you've got to know your side effects and your food interactions, and is it's the right medication for your lifestyle. And two, you got to see how long you have to be on them, because then I would think a lot of these, there are long-term side effects, or they have the law of diminishing returns, or they no longer work, right?
Right, and any medication can have a side effect. Matter of fact, the anti-inflammatory medications, the ibuprofens, naproxens, and everything else are notorious for this, because how many people have you talked to who have had upset stomach or gastritis, or even bleeds from their stomach or intestine from chronic use of these medicines? So they all have side effects, and to me, I want to focus on the ways our body can heal themselves first. Some people will do well with the medication, but I don't want to use a medication. I would prefer somebody not be on a medication unless they really need to, unless we've gone through everything else. And again, I think the really encouraging moment in time we're in is that we have many more tools now, and we know how to use them. I'll use a good example. Actually, we were talking about exercise, and that the cycle of inflammation recovery and platelet-rich plasma. For instance, we now know the dose we need for PRP to be effective. PRP has been a very controversial topic. There were studies that showed it worked, and that was a big study that showed it didn't work, and everybody kind of said it just doesn't work. Well, it turns out if you look at what they're actually dosing, you have to get to a certain dose to make it effective. And it makes sense. It's like exercising. If you don't push yourself at least a little bit, you're not going to get stronger. You have to push at least a little bit. And you have to find that Goldilocks range. And that's the same thing with regenerative therapies. Again, all these therapies come back to our own bodies, and it's not rocket science. We're just trying to figure out ways to harness what our bodies have been doing for a very long time.
And just PRP, and I'm in your glossary, is platelet-rich plasma created by spinning blood in a centrifuge and allowing the platelets to separate. Is that like plasmapheresis?
It's a little different. So it is basically you take whole blood, you centrifuge it, and cells have different weights. So the red cells sink to the bottom, the plasma's on top, and in the middle, the platelets sit. The platelets are helpful because we know them as causing clotting, but they also contain a lot of growth factors. And so it's the growth factors that we use to go ahead and inject. And those are the things that we're looking for. We really are looking for the contents of the platelets, which they'll release after
So these are injections that you get.
It's an injection, exactly. So you take that, you take out, usually using a device, that middle layer that has platelets in it, and then you inject it into a knee, into a shoulder, into a hip, other areas. But the key is you've got to get the dose right.
Mhm.
And that's what we didn't know even a couple of years ago. So that's another, I think, really an exciting advance.
Well, in the glossary, platelet-derived growth, there's a lot of interesting things in here in your glossary, by the way, including paclitaxel, which I almost died from during treatment.
Yes.
Again, everybody out there, don't just say, I'll take the drug. Learn what it's going to do to you.
Yes.
Because
Yes.
you can have some amazingly bad side effects. So here's the million-dollar question.
I'm ready.
Treatments like PRP, are they covered by insurance, or do you have to jump through a million hoops and get approvals and whatnot? Because when David, my husband, had to get plasmapheresis, which is a different protocol,
It
but there
is.
was another one he got approved for that, but there was another one in there. We don't know, but it was rejected.
Right now, almost none of the regenerative therapies are covered by insurance. In the
Sorry.
future, in the future, I think that they will be. I think as we learn more, but right now it's very easy for an insurance company to call these therapies experimental because they can point to studies that were done where they didn't help. And that's why we need to go back and we need to redo those studies. I talked about dose, redo the studies with doses that are effective, but they're going to remain experimental in the eyes of insurance companies until the research is done.
Well, that's why my mother didn't get it, by the way,
Hmm.
because she was rejected. So that, that it stinks for you because you want to help patients.
Yeah.
And it stinks for anyone who needs the treatment. So, the only winner in that one is the insurance companies, and everybody else loses out.
I liken it to
Sorry.
right now, it's very easy to get coverage for things that suppress the immune system, but not those that stimulate the immune system. If
I
you
get
think
so
about it.
mad when I watch TV, Dr. Beck. It was every damn commercial is a drug commercial for pain. And I
Now,
get really mad because it's like, stop paying all that advertising and let us all get insured so we can get these other treatments.
now who's also kind of at the forefront of a lot of these therapies too are the physical therapists.
Yeah, I'm a big.
They
I do. They're great. I've
do
been doing one for my back.
Yes, they do wonderful work, and they also do things like dry needling, which you could argue dry
Yeah.
needling is a bit of a regenerative therapy. They do all those things that we talked about that stimulate a healing response.
But
So they're
eventually their insurance is not covered anymore because I did it for my back and then I had to leave because, it wasn't covered. And now my back hurts again.
But you can get coverage for the anti-inflammatories and steroids that suppress the
Yeah.
what system, but
Yeah.
not things that stimulate. Yes.
Right. And that's just
Yes.
like crazy. I think we're on the same page there. So, what is on the horizon that you're excited about?
I am excited about the ways to tailor therapy. So we now have these broad therapies that can be very effective. And my question is always, how do we make them more effective? And how do we choose who's going to respond or not? So I think that the science of understanding how our bodies respond to a therapy, I'll use PRP as an example, platelet-rich plasma, because it's fairly commonly done. Although we've actually, a lot of the research that I've done with colleagues at Duke and McGill, where I'm now in Germany, our research is really focused around more autologous conditioned serum, which is the Regenikine program. We actually know how that works deeply.
What is that? What is a Regenerate? Your program?
That is a program that uses it's a blood product, but it's not PRP. It's a blood product that it also creates exosomes and some other things that can reprogram how cells behave. Some people know of Regenikine when there are a lot of professional athletes that fly to Germany and that I treat now in my clinic as well. But when you hear professional athletes going to Germany for treatment, oftentimes it's for the Regenikine program because that's where it started. And that was one of our research colleagues and my mentor, Dr. Peter Whaling. But we know how that works. And we're also learning now how PRP works. But to me, there's a question of some people will respond and some people just aren't going to respond to PRP no matter what you do. And we want to know why. And we believe it has to do with the body's immune response, the ability to trigger body's immune response. Some people may need a stronger trigger than others. And I would love to see a test that develops that allow us to find out, because you don't want to spend a lot of money out of pocket for an expensive procedure if it's not going to work. And I'd love to have a
Right about
test
it.
that says that we can make this work, but we have to add in these 2 or 3 additional components to make it work. So that's exciting. And in all these things, all these therapies, they're helping us to understand how we heal more fundamentally. I think it's a very exciting time. And this actually gets back to not just a regenerative therapy, but how do you heal a cut, a wound, a fracture? How do you heal from surgery? All these mechanisms are common for all these things that we do. And how do we increase our ability to heal?
Well, I'm healing from surgery from October. I had surgery and then I got an infection. I had another surgery and that did me in, and it's still healing, and I'm in pain. I'm going to go deal with it when I see my PCP and surgeon this week. But healing from surgery is a much slower process, particularly the older you get, and that's been a learning lesson.
Yes, well, right. Healing takes time. And the more we can understand the mechanisms that drive it, I think the better off we are. And there's also a growing question of, should we be taking long-term anti-inflammatories after surgery as well? That's been the standard has been for people to take anti-inflammatories, whether it's ibuprofen, naproxen, meloxicam, any of those medicines, Celebrex as well, to take them for weeks after a procedure, after a fracture, after a surgery. And I think we are appropriately questioning whether or not that's the right guidance, because
Well, I didn't take any. I first of all, none of it appealed to my very sensitive stomach. And again, my mother had no stomach left, I think, because she was on so many drugs.
yes,
And I think that's happening to me. So I'm big on tapering off. I tapered off the pain. I tapered off the pain medication almost immediately. For all the reasons that you would expect.
yes,
It was,
yes.
and again, I'd rather have a higher pain threshold and strengthen that than just suscept. But so many people live with pain. It's just chronic pain is like everywhere.
It is, and it's one of the challenges. One of the things that I want to talk about in the book is this difference between acute pain and chronic pain.
Right.
Chronic pain is always bad. There's not a
Yeah.
single scenario where chronic pain is good for us. But we have, as a medical profession, we have assumed that therefore all inflammation is bad. And if chronic inflammation is bad, then acute inflammation is also going to be bad for us. That's just not the case. Acute inflammation, short-term inflammation, can turn on these healing mechanisms that our bodies have and actually prevent long-term chronic pain problems.
Acute inflammation.
Acute
So what is an
inflammation.
example of acute inflammation?
Well, actually, I'll use the example since I'm at McGill right now in Montreal. Actually, there was a research study that was done here. They looked at 100 patients who had acute back pain, and they looked at the inflammatory response to the back pain. And those who had a strong inflammatory response actually healed faster and were less likely to have pain 3 months out. If they suppressed it with anti-inflammatories, they were more likely to have pain.
So I should work into the pain. I mean, sometimes you work in with exercise, you work into the pain.
Yes. So there's a Goldilocks position here that you don't want to hurt so much you can't move, because if you can't move,
Right.
you're never going to get better, and you're going to get a blood clot. You're going to have all those other issues too, right? So we want to be able to move, but we want to have some inflammation at the time of an injury, whether it's a back pain injury, whether it's an ankle sprain, whether it's a fracture. We want to have some inflammation, because that inflammation will turn on our natural systems.
Well, that's interesting, because I've been doing the work into the pain all my life, through, versus hiding from it, because I'm so fearful of pain pills. So I think that's very interesting. I have one, there was, the FDA recently approved or announced a new hope for easing rheumatoid arthritis, the set point system. What do you know about that?
Very little, very little.
Hmm.
So, yeah.
Hmm.
And, rheumatoid arthritis that's a little different argument too. I can compare
Right.
the studies that were done. For instance, your mother may have been on one of the, what are called DMARDs, the disease modifying anti-rheumatic, these drugs that suppress inflammatory proteins. Interestingly, they can be very powerful for rheumatoid arthritis. They've all been tested in osteoarthritis. They don't work at all.
My mother was on so many drugs for her pain and osteo and the other, and then the pain from the stomach ailments from that there were just bags of drugs everywhere. It was awful. I want to live in a world, and I think you do too, where we're not on painkillers.
That would be a wonderful world.
And we're living without pain.
Even better, we don't need to use them.
Right. Living without pain.
We don't need to use them. That is the ideal. Absolutely.
Yeah. And as we said, a lot of it just starts with the simple, most basic things is to improve the quality of your life, improve how you eat, how you move, and how you manage your stress.
Absolutely.
Get off your seat, like I'll be doing in a few seconds, to go take a walk, because I have another show in an hour. I get up and go walk and stretch. I mean, I'll even at the post office waiting in line yesterday forever. I started doing yoga exercises and everybody started following me in line because we're all going crazy. You just find ways to move at all times.
Well, I think that is the secret. So you have the first two secrets, which is a good Mediterranean diet and movement. And there are other tools that we can tap into, but those are the most important and most fundamental, aren't they?
Well, I really enjoyed talking with you again, Dr. Thomas Buchheit. He is a regenerative medicine therapist. This is the book, Healing Joints and Nerves. Oh God, I can't see it on the screen. I'll put it up on Melanie Fabulous, but Immune Stimulation and the New Science of Regenerative Therapies. It's clinical, but it's helpful. And there's some great takeaways at the end of each chapter.
Thank you, Melanie.
The biggest takeaway is you should not have to live with pain.
I think that's great. And don't fear exercise.
It's not exercise, it's movement
and motion and
healing. Movement and motion. Yeah. Just movement and emotion. And there's simple things. Go walk a dog, or go to an animal shelter and go borrow a dog. That's like one way. 2, walk with your friends. The social thing, because we need to socialize. I walk with my husband and we actually don't talk shop, which is great. Just if you don't want to walk alone, walk with people and socialize. There's always a way.
Yes. And actually you're getting into the blue zones now, aren't you? Of the social connection being a really important part of that, right? Exercise, food, and social connection and meaning in life.
And rest.
And rest and recovery.
Yeah. R&R. Well, thank you for joining me on Fearless Fabulous You. I really appreciate your time. Good luck with whatever you're doing in Montreal with all your speaking and whatnot. And,
thank you, Melanie.
Keep going and help us all live without pain.
A pleasure to speak. Thank you so much. Great to talk.
You've been listening to Fearless Fabulous You. Follow me at Melanie Fabulous and check out this show on YouTube and over 65 podcast channels on demand. You have the choice in life to live with confidence and in good health. Always choose to live it on your terms and choose fearless and fabulous. Thank you.